If you would state your name for the record, and you're going to have to move the microphone over.
Sure.
No, yeah, just move it up. And it moves. It, like, you can pick it up and move it closer. You don't have to move over. Just move that microphone. Yeah, there you go.
It's okay. I'm Dr. Neeraj Shah, and I am speaking on behalf of myself. I'm in favor of House Bill 594. And I just want to give you a quick introduction. I'm a physician. I practice here. I live here in town and basically 2 miles away, and I practice with Seton. I'm a critical care doctor, a ER physician, and also internal medicine hospital physician for Seton in Hayes. This is Seton's one of the 3 big flagship hospitals down in Kyle. I also practiced at the Temple VA when I first moved here to town about 3 years ago. And then in terms of my background, I trained at Rice and Baylor in Houston. Baylor is my medical school, and I'm proud to say I'm Texas trained. I also went to UT Southwestern for residency for internal medicine, and then did a lot of hours in critical care and ER. And you're probably wondering how a physician from a pretty straight-laced conservative Indian family and spent 30 years of his life in Texas is up here, testifying for this bill. Probably the only physician in Texas right now that's probably willing to do this. After my residency, my sister was in San Francisco and my niece was born, so I had a chance to go out there. And I worked for Kaiser Permanente, which is, probably the best healthcare organization west of the Mississippi as far as managed care. And something new that I encountered when I first got there that I had not encountered in patients here in Texas was about 1/4 to maybe even 1/3 of my patients on my primary care panel. I had a 2,000 patient panel with Kaiser that I was responsible for. Probably about, 400 or 500 of them were actively either using marijuana for their various symptoms or were on the medical marijuana registry in California. And they were just coming into the office wanting to talk about things like it was just another day in clinic. And I said, well, listen, I'm going to have to do some homework here because I'm from Texas. So the 2 main questions that I had in the beginning was, number 1, is this even effective? Is marijuana really medicine? And number 2, is marijuana safe? Is this safe enough for me as a physician to at least look the other way and let them participate in the program? I spoke to Kaiser management at that time, and I wasn't willing to do any recommendations or put my name out there for this service, and neither was the corporation. But I did do a lot of listening, and I had patients from multiple backgrounds, including severe chronic pain on fistfuls of medication, advanced stage 4 cancer, actively undergoing chemotherapy, diabetic neuropathy, saying that their legs were on fire, like someone had poured gasoline and lit a match. People that had surgeries, a lot of post-thoracotomy pain, people saying hot sores were hanging out of the rib cage. So I started paying attention, to chronic pain pretty closely because most of my panel had it. And in the effectiveness realm, some of the homework included there's a continuing medical education series that actually gives you AMA PRA credit at level 1, and this is through the University of California, San Francisco, top 5 medical schools. And there's probably hundreds of hours of lectures that included both clinical trials, case reports, and research, both from prominent universities in America and internationally. And after looking through, many of those, and also contacting some faculty at the local universities, I became familiar with 2 studies I want to share with you, and the 2 questions on safety was, number 1, does this cause cancer? It's a smoke substance. Does marijuana cause lung cancer? And the second one is, since it is smoke, does it cause emphysema or COPD the way that cigarettes do? And the first study that I wanted to share was by Dr. Donald Chashkin, and he is a pulmonologist at UCLA, and he basically took about 1,000 cancer patients in the LA area. And he took 1,000 patients in the LA area, and he compared for rates of progression to emphysema. So he followed these patients for 10 years, and there were 3 categories. There were non-smokers, tobacco smokers, and marijuana smokers. And what he found was, at the end of the study, 10 years follow-up, they were doing pulmonary function tests every year. They were even doing biopsies and taking a tube down into the lung and biopsying. But what they were able to conclude was that tobacco definitely leads to COPD, and that marijuana smokers actually did not progress to decreased lung function and did not have emphysema. And in looking at the retrospective studies, although it was smoked, the science has some theories about why this is happening. COPD never developed. In a second study by Yeah, the second study I wanted to share with you was also a study about marijuana and its link to lung cancer. This is by Dr. Hashibe, not on West Coast Med School. He was actually out of the University of Utah School of Medicine. And he looked at basically 1,000 patients. This is a retrospective study. And they looked at 1,000 patients with head and neck and lung cancer. And then they also looked at 1,000 matched controls. And then they compared within those groups basically smokers, non-smokers, tobacco smokers, non-smokers, and marijuana smokers. And in that study, which is a very well designed study, International Public Health on the committee, it was what you would expect for tobacco. So the tobacco smokers had about 3 to 4 times increased incidence of lung cancer and head, neck, upper airway cancers compared to non-smokers. Now, where the marijuana smokers fell was a little bit surprising to me, that they had a lesser incidence of lung cancer than the non-smokers, not than the tobacco smokers, than the non-smokers. And so the author of the study went on to say, heavy chronic marijuana consumption does not increase long-term risk for lung, head, and neck cancer. So those were kind of the two early kind of trials that I came across from. In terms of other points regarding safety, there are a couple of quick things, and I know time's limited, but...
yeah, if you could, go ahead and wrap it up in the next 15 seconds.
Oh, sure. So in terms of safety, in my 10 years of experience in seeing 40,000 patients, I've seen many, many complications of tobacco and alcohol. I've yet to see a complication in the ER, clinic, or the ICU directly related to marijuana outside of DUI and car wreck. That's essentially bad choices and bad behavior. The direct toxicity to the body and organs, I've yet to see. The lethal dose is somewhere around 1,500 pounds that has to be consumed in 15 minutes. So this is based on rat studies. So the first round didn't go well because they couldn't kill the rats, and then they came back and finally did a calculation. So a plane has to fly over you and drop the bag on your head to actually kill you. And then...
Thank you, Doctor. And in conclusion...
Yeah, and then kind of like the closing point I wanted to make, and it's relevant to a lot of the patients that presented their stories, and I was really, it just takes me back to clinic and the hospital because I hear this every day. I've been hearing this, day in and day out, and they turn to me as a primary care doctor when, they've exhausted their resources with medications, procedures, surgeries, specialists, and then they come back and say, well, listen, I have chronic and severe pain, nausea, vomiting, headache. Is there anything I can do besides these pills and procedures? And, I say you either have to look for another state or go to the capital.
Thank you very much.
Yeah, I'm happy. In general, I'm always happy to serve as a resource since I did have a little bit of experience in a part of the country that does this, and I'm happy to answer questions.
Doctor, I want to ask a question. I know that there have been cases, an institution has been able to isolate certain properties of cannabis and turn them into pill form that is perfectly, prescribed by a doctor and is perfectly legal, and they give it to cancer patients.
Sure.
And I know I think that's used to treat loss of appetite.
Mm-hmm.
Are there any other uses for that have been helpful that you know about? Or is that not a proper substitute, an appropriate substitute?
The problem was kind of the one legal form, and what you're referring to, I believe, is Marinol, the synthetic cannabis that's available as a prescription to a doctor in the hospital and in the clinic. I've written for very little of that, only if the patients, absolutely asked for it and it was a last resort. But my experience with the patients that I prescribed it to is that most of them don't like the way that they feel on it because it's kind of a long-acting formulation. It's absorbed orally. It causes a lot of sedation, and also they don't find it quite as effective no matter what the dose is. And it's like giving someone a long-acting oxycodone. That may not be the best thing to give someone for a short-acting symptom. So its efficacy, the other problem is, cannabis itself contains about 84 what they call cannabinoids, the actual molecules that bind with the receptors in the brain. And synthetic THC only has one of the 84 cannabinoids. So you're missing, many things that are naturally, in the medicine that may perhaps not be there in the prescription pill. And, if you just ask patients who take it, they'll probably tell you similar things.
Thank you very much.
This thing I was on for 12 years, and my doctor still said I needed to smoke because again, it didn't supply all of the milk. So.
Yeah. So you recognize yourself. You have to repeat your name again to the microphone.
Jeff Stefanoff, I'm for the bill, and
Yourself. Yeah. Thanks so much. Representative Guerra.
Yes, sir.
I think it was about a couple of years ago when Larry King was still around. Remember Larry King?
Yeah, I remember. Who doesn't remember Larry King?
One of his last interviews, and I remember this, it struck me, because he's from Texas, was Willie Nelson.
Oh, yeah.
And Larry asked him point blank, do you still smoke marijuana? And Willie said, no, I quit. I don't smoke anymore. And Larry was kind of surprised. And then Willie said something to the effect, I use a vaporizer. What was he talking about?
No, that's an excellent question, because that's actually one of the most important public health questions, I think, for this issue. Is I'm actually uncomfortable with people smoking marijuana also. I'm actually against smoking of anything. What he's talking about, the vaporizer, is basically, marijuana comes as a plant, and there are different vaporizers. It's a device that will just heat the plant to a certain temperature, and my understanding from what I've read is that it heats it to a temperature above which cannabinoids will vaporize. So that's why they call it a vaporizer. The cannabis or the molecules that are actually active in the plant will vaporize at that certain temperature and produce kind of a mist and a vapor. But in that vapor, you don't have the noxious chemicals like carbon monoxide, carcinogens, PDCs, and the things that you get from burning either a tobacco plant or a marijuana plant. So vaporizing for marijuana, and there are actually studies underway comparing vaporized cannabis to smoked cannabis to non-smokers currently that are in clinical trials. But the idea is that the cancer comes from the particles that are ignited and smoked, not from the cannabinoids, and that's kind of the main push behind vaporization, is that it's a healthier route. Taking it orally and vaporizing it is a much healthier route than smoking it, and that's kind of the next round of clinical trials and advice to patients. That's kind of coming.
So that's what Willie was talking about.
Yeah.
Great. Thank you very much.
Appreciate it.